Are you or someone close to you taking Abilify, or maybe your doctor mentioned it and now you're searching for real answers? Well, you're in the right place. In this video, I'll explain what Abilify is, how it works, who it's meant for, and what you absolutely need to know before taking it. So, stick around. This could be the most helpful 7 minutes you'll spend on your mental health today. Now, we're diving into Abilify or Aripiprazole, which is its generic name. It's a prescription medicine that's widely used in the United States, UK, Canada, Australia, and Europe. Abilify belongs to a group of medications called atypical antipsychotics. That just means it helps rebalance chemicals in the brain, particularly dopamine and serotonin, which affect your mood, thoughts, and emotions. What's different about Abilify is how it works. Rather than fully blocking dopamine, it acts as a partial agonist. In simple terms, it helps bring dopamine levels up or down, depending on what your brain needs. That's why many people find it has fewer side effects compared to older antipsychotic meds. So, how Abilify works? Let's break it down. Your brain uses dopamine to regulate your mood, behavior, and even how you think. In conditions like schizophrenia or bipolar disorder, those dopamine levels can go way too high, or drop too low. That's where Abilify comes in. Instead of shutting dopamine off completely, like older medications do, Abilify adjusts the levels gently. Think of it like a dimmer switch, not an on or off switch. This balance is what helps control symptoms while reducing side effects like weight gain or extreme drowsiness. So, when do doctors prescribe Abilify? It's approved by the FDA and also trusted by regulatory agencies across Europe and beyond. Here are the main conditions it's used to treat. 1. Schizophrenia. It helps reduce hallucinations, delusions, and confusion in adults and teens 13 and older. 2. Bipolar I disorder, especially during manic or mixed episodes, and even in children as young as 10. 3. Major depressive disorder, used as an add-on when antidepressants alone aren't enough. 4. Autism spectrum disorder helps manage irritability, mood swings, and aggression in children. 5. Tourette syndrome can reduce involuntary tics and outbursts in kids and teens. Doctors may also use Abilify off-label in some countries for conditions like anxiety disorders, borderline personality disorder, and OCD, but keep in mind, this is a prescription medication. Never take it without guidance from your doctor. So, Abilify comes in a few different forms. There are tablets which range from 2 milligrams to 30 milligrams, an oral liquid, and long-acting injections like Abilify Maintina or Abilify Aristada that are given, about once a month. Most people will take the tablet just once a day, with or without food. Your doctor will decide the best dose for you, based on your age, your medical history, and how you respond to the medication. And really important here, don't stop, skip, or change your dose on your own. That should always be done under medical supervision. Like any medication, Abilify can cause side effects. Some are mild, but others may need attention. Common side effects include nausea, feeling restless, also known as akathisia, trouble sleeping, headaches, dizziness, and anxiety. Let's see less common but more serious side effects. Tardive dyskinesia. These are involuntary muscle movements, often in the face. Neuroleptic malignant syndrome. A very rare but life-threatening condition. Increased blood sugar or risk of diabetes. Suicidal thoughts, especially in young people or those just starting the medication. If you notice sudden mood swings, uncontrolled movements, or symptoms like excessive thirst or frequent urination, call your doctor. Now let's talk safety. Abilify is not recommended for elderly patients with dementia-related psychosis. It may increase the risk of stroke or death. Also tell your doctor if you have diabetes, heart conditions, or a history of seizures, have liver or kidney problems, are pregnant, planning to become pregnant, or breastfeeding, and avoid alcohol or cannabis while taking Abilify. These can increase dizziness, drowsiness, or worsen side effects. Here's some good news. While the brand name Abilify can be pricey, the generic version, Aripiprazole, is much more affordable. It's widely available and covered by most insurance plans in the United States, United Kingdom, Canada, Australia, and the European Union. Ask your pharmacist about generic options or patient assistance programs if cost is a concern. So, is Abilify right for you? That decision should always be made with your doctor. But now at least, you're armed with the facts. If you found this helpful, give this video a like. Don't forget to subscribe for more easy-to-understand videos on health and medicine. And here's a question for you. Have you or someone close to you used Abilify? What was your experience like? Drop your answer in the comments. Your story could really help someone else. See you soon in the next video. Thanks for watching.